Uthi banethemba lokuthi idolobha laseGoli lizofika kulesibhedlela khona ntambama nje lizohlola bese likhipha isitifiketi.
The City of Johannesburg will be arriving this afternoon at 3 to come and do one inspection and then issue us with the certificate of occupation, which is a requirement. That certificate of occupation give rise and confidence that one, we are now fully compliant with the Fire Act. Secondly, we are compliant with the Environmental Act. Thirdly, the building is safe in terms of use and in terms of structural fitness.
Isisebenza lesibhedlela sithi sijabule kakhulu ngokuthi sivulwe lesibhedlela njengoba bekunzima kakhulu ezigulini zabo.
Thank you so very much to everyone in the hospital, to the Department of DID, to the Premier for just everybody pushing to get us back open. We are very grateful. It has been very difficult for our patients to manage, and we're grateful to Steve Biko for the assistance they've given us. But we're very, very happy to be coming back.
Umphathi wekhomishana yamalungelo abantu eGauteng uBuwang Jones uthi kubaluleke kakhulu ukuvashela esibhedlela njengoba kufanele babheke ukuthi sesikulungele yini ukuphinde samukele iziguli ezihaqwe isifo somdlavuzi ezayiswa kwezinye izibhedlela kulandela ukuquba komlilo kanti futhi lokhu kuzokwelekelela kakhulu njengoba lesifundazwe sinesibalo esiphezulu sabantu abahaqwe iCovid-19.
We deemed it appropriate and in the public interest to conduct the monitoring visit then, and we also feel it is important now to assess the readiness of the hospital, particularly the oncology unit, because we want to avoid another crisis.
Le komishana ithi ihlangene undunankulu waseGauteng ngolwesithathu bavumelana ngokuphinde kuvulwe lesibhedlela kodwa sizovulwa ngezigaba ezihlukene.
We fully support the reopening of the hospital. It should be opened in phases. They will start off by reopening the oncology unit on the 28th of June.
Uqhube wathi umnyango wezempilo eGauteng ubheke nobunzima obukhulu njengoba izibalo zabahaqwe iCovid-19 kulesifundazwe zikhuphuka kakhulu.
The healthcare system in Gauteng is currently what one would term is jammed. It's clogged, and we need this facility to be reopened so that we are able to increase the bed capacity to assist the government's response in dealing with this global pandemic.
Ukuvula futhi kwalesibhedlela kuzokwehlisa ingcindezi enkulu kulesifundazwe njengoba kuzovuleleka eminye imibhede kuze kwemukelwe iziguli ezihaqwe iCovid-19.